So this will be like an introduction to three concepts where we get to look at the inguinal canal. All right, we'll get to look at its contents. All right, then we'll get to look at what the inguinal hernia. Okay, so I think let's not waste time. I'll just go straight to it. Now you see this side, you can see this is a picture of a human being, and at the groin, okay, deep in the groin you have this canal like a tunnel, okay, having two openings. All right, so you see the opening that is inside is known as the what? Deep inguinal ring. The one that is outside is known as the what? Superficial inguinal ring. Okay, so we're having an overview of this inguinal canal. Talk about it. We're going to talk about the walls and the rest. Okay, we'll talk about the content. So for the inguinal canal, we said that the inguinal canal is approximately what? 4 centimeters long. Okay, and it's directly what? Obliquely. See here, it's kind of like bent, right? 4 centimeters long, directed obliquely. Okay, so it is directly obliquely inferior medial. All right, it's coming down but close to you. All right, so it's inferior medial through the inferior part of the anterolateral abdominal wall. Okay, so the canal lies parallel about 2 to 4 centimeters superior to the medial half of the inguinal ligament. Okay, and this ligament extends from the anterior superior iliac spine to the pubic tubercle. All right, so where it extends, anterior superior iliac spine to the what? Pubic tubercle. Okay, and moving now, we said that the inguinal canal has openings at both ends. You see here. Okay, we said that the deep or internal inguinal ring is at the entrance to the inguinal canal. Right now, it is the site of an outpouching of the transversalis fascia. All right, so this is approximately what? 1.25 centimeters superior to the middle of the inguinal ligament. Okay, now the superficial, or also known as the external inguinal ring, is the exit from the inguinal canal. Okay, so now it is what? A slit like, okay, opening between the diagonal fibers of the aponeurosis of the external oblique. Okay, now let's look at the walls of the inguinal canal. All right, quickly look at the walls. The anterior wall is formed by the aponeurosis of the external oblique. Okay, posterior wall is formed by the transversalis fascia. All right, just like we said, this deep inguinal is the outpouching of transversalis. All right, so that's at the back. At the front, we're saying that's aponeurosis of the external oblique. All right, so this is just us talking about the same thing all over again. So the posterior wall is the transversalis fascia. The roof is formed by the arching fibers of the internal oblique and the transverse abdominal muscle. Okay, so the floor is formed by the inguinal ligament. Okay, which forms a shallow through. Okay, so now it is what reinforced in its most medial part by the lacunar ligament. Okay, so talking about the contents. Talking about the contents of the what? Inguinal canal now. All right. So the inguinal canal is mainly just three main contents. All right. The spermatic cord, the ilioinguinal nerve, and ilioinguinal lymph node. All right. But this spermatic cord, where is it? Well, this is the cord. All right. This spermatic cord also has some content, and that's where what the main problem actually comes from. Okay. So the contents of the spermatic cord includes the ductus vas deferens and its artery, the testicular artery and the venous pampiniform plexus, the genital branch of the genitofemoral nerve, the lymphatic vessels and the sympathetic nerve fibers, fat and connective tissues that are surrounding the cord and its covering in various amounts. Okay, so guys, how's it about what inguinal canal, its contents and Inguinal hernia just simply means what? You have like what? Um, there will be a protrusion, okay, out of the inguinal canal. All right. I'll be making a main core video on inguinal canal in the next series. Okay. So see you guys.